Can I ask you something personal? Have you ever walked into a checkup just to be safe? Only to leave with more worry, more medication, and more fear? You're not alone. Every year, more than 20 million Americans over 65 go in for routine tests, not because they feel sick, but because someone told them it's just part of staying safe. But what if I told you some of these tests, the ones we do without thinking, can quietly damage your brain, your heart, or even shorten your life? This isn't a conspiracy. This is real science. And after 30 years as a neurologist working with older adults, I've seen it with my own eyes. A harmless scan, a quick blood test. Suddenly, you're on a drug you didn't need, facing side effects that no one warned you about. In today's video, I want to walk you through 5 health checkups that seniors over 70 should seriously reconsider. Because some of them, they don't protect you, they expose you. Now let's make this a two-way conversation. In the comments below, where are you watching from? Are you over 60? And have you ever gone through a test that you later regretted? Type yes if this has happened to you. Type no if you've been lucky so far. We read every single comment and reply with personalized advice. And if you care about protecting your brain, your memory, your independence, then subscribe to this channel. Because here at Dr. Brain, we don't just react, we protect before it's too late. Let's begin. Number 1, the bone density scan that steals strength, not saves it. Let me tell you about Rose. Rose was 76, a retired piano teacher. She walked every morning. She ate her greens. She had never fallen, not once. Then one day during a routine checkup, her doctor suggested a bone density scan. He called it quick, painless, just to see if her bones were thinning. The scan came back showing osteopenia. That's the medical term for mild bone loss, not osteoporosis, just a little below average. And just like that, her life changed. She was put on a medication called alendronate, a drug in the bisphosphonate family. It was supposed to strengthen her bones. Instead, within 3 months, Rose had acid reflux so bad she couldn't sleep. Her jaw began to ache. Her body felt stiff. And worst of all, she stopped playing piano. The one thing she loved most in this world, silenced by a pill she may not have needed. Now let me be clear. Osteoporosis is real. Bone fractures are dangerous. But here's the truth. By the age of 70, nearly every person has some degree of bone thinning. It's as normal as gray hair or wrinkles. It doesn't always need medication. A study in the Journal of the American Geriatric Society followed over 1,200 women over 70 years old. It found that the drug alendronate reduced fracture risk by only 0.3% over 5 years. That's not zero. But it's not life-saving either. And the side effects? Jaw decay, esophageal damage, and even brittle bones that break in unexpected ways. So what should you do instead? Eat more calcium-rich foods, sardines, spinach, almonds. Do lightweight bearing exercises, walking, resistance bands, and above all, check your vitamin D levels. A 2022 study in Osteoporosis International found that older adults who took vitamin D and did balance training reduced their risk of falls by over 20%. No side effects, no pharmacy bills, just a stronger, safer you. So let me ask you, have you or someone you know ever taken medication for low bone density and felt worse afterward? If so, share your experience in the comments. Your story might help someone else pause and think twice, because not every scan deserves a prescription. And sometimes real strength begins with less fear and more movement. Number 2, when a brain scan makes you forget who you are. Have you ever walked into a doctor's office for forgetfulness and walked out thinking you might have dementia? It happens more than you think. Every week, I meet seniors who say things like, I lost my keys again. I forgot my neighbor's name. Or, I opened the fridge and forgot why. Normal things, human things, things that happen to anyone under stress, lacking sleep, or simply aging gracefully. But here's what often happens. The doctor hears the word memory, and suddenly a brain MRI is ordered. Now let me explain what that means. A brain MRI is a scan that shows detailed pictures of your brain structure. It looks high-tech. It feels powerful. And it often makes people feel like they're finally going to get answers. But here's the reality. For most people over 70, brain MRIs show white matter changes, tiny spots, small shrinkage, medical terms like microvascular changes or mild atrophy. These are incredibly common and almost always harmless. But the problem is this. Once people see those words in a report, fear kicks in. Take George, for example. George was 74, a retired engineer, sharp as ever, but starting to forget names at church. His doctor sent him for a brain scan. The MRI came back with white matter hyperintensities. No one explained what that meant. So George assumed the worst. He stopped driving, stopped leading Bible study, stopped going out to eat. 3 months later, George wasn't sick, but he was deeply anxious, withdrawn, and depressed. When we did a proper memory test, a simple cognitive screen, he scored completely normal for his age. We reassured him, educated him, and helped him rebuild confidence with sleep, hydration, and brain stimulation games. Within weeks, George was back. So here's the truth. Unless you're having seizures, personality changes, or sudden severe decline, a brain MRI might not help. In fact, it might scare you unnecessarily. Instead, ask your doctor for a MOCA or a mini mental state exam. These are short paper tests, no machines, no radiation, and they give a real snapshot of your memory, attention, and thinking skills. The American Academy of Neurology has stated that for most older adults, clinical observation and cognitive screening are far more useful than imaging in early memory loss. So let me ask you this. Have you ever had a brain scan that left you with more fear than answers? Or know someone who became more anxious after seeing the word atrophy or lesion in a report? Share your story in the comments below. You never know who you might help, because memory loss doesn't always mean disease, and a scan doesn't always mean clarity. Sometimes the best thing to do is breathe, sleep well, hydrate, and test the brain, not the fear. Number 3, the heart test that breaks more than it protects. Let's talk about fatigue, not exhaustion, not collapsing, just a quiet kind of tired. You walk up a small hill and feel winded. You go grocery shopping and need to sit a little longer than usual. Most of the time, it's just age, hydration, or a poor night's sleep. But in the medical world, that quiet fatigue, it often triggers one thing, a cardiac stress test. If you've never had one, here's how it works. You walk on a treadmill while your heart rate and breathing are monitored. Or if you can't walk well, you're given medication to mimic exercise. The goal is to see if your heart is getting enough oxygen, if there are blockages, if something looks wrong. Sounds useful, right? But here's what many doctors don't tell you. In people over 70, stress tests can create more problems than they solve. Why? Because the older heart can behave differently, even when it's perfectly fine. And that leads to false positives, scans that suggest heart disease where there is none. And once that result is printed, the path begins: angiogram, dye injection, and in many cases, stent placement. But here's the truth. A landmark study published in JAMA Cardiology in 2017 followed thousands of seniors who had stents placed after stress test results, and they found no significant improvement in survival, no big change in quality of life. What they did find: increased hospital stays, more bleeding complications, and higher risk of kidney injury from contrast dye. Let me tell you about Raymond, 75 years old, a retired postman, still walked 2 miles a day. One day, he told his doctor he felt a little tired walking uphill. No chest pain, no shortness of breath, just not quite like before. The doctor sent him for a stress test. The results were borderline. So Raymond had a catheter test where a thin tube is threaded into the heart. They found a mild narrowing in one artery. They put in a stent. That night, Raymond had a reaction to the dye. His kidneys began to shut down. He spent 6 days in the hospital and weeks more recovering from something he never really needed. He didn't feel any more energetic afterward because his heart wasn't the problem. He just needed more rest and more water. So if you're over 70 and you don't have classic symptoms like sharp chest pain during activity or sudden breathlessness during simple chores, a stress test might not be your best option. Ask instead for a resting EKG, a calcium score scan, or a careful discussion about your symptoms first, because the point is not to fix what isn't broken. It's to protect what's already working. Let me ask you, have you or someone close to you ever ended up in the hospital after a routine heart test? Leave a comment below. Your story could help someone avoid the same path. Because sometimes the most dangerous thing is not what we feel, but what we rush to test. Number 4, the colonoscopy dilemma. When screening crosses the line. You've probably heard this line before. Colon cancer is silent, so get checked before it's too late. And that's true, to a point. Colon cancer is serious. Early detection matters, but after the age of 70, and especially past 75, colonoscopy can shift from helpful to harmful. Let me explain. Colonoscopy is a procedure where a long, flexible tube with a camera is inserted into the colon to look for polyps or cancer. It usually requires strong laxatives the night before to clear the bowels, then sedation during the procedure, and finally, a recovery period. Sounds thorough, but for many seniors, especially those who are otherwise healthy and symptom-free, this test can backfire. Why? Because the preparation itself is stressful. It can cause dehydration, electrolyte imbalance, dizziness, and for some, kidney problems. Then comes the sedation. In people over 75, even light anesthesia can increase the risk of confusion, memory problems, and even delirium. Your brain just doesn't handle sedatives the way it used to. And here's the most surprising part. A 2019 study published in JAMA Internal Medicine followed over 1.3 million Medicare patients above the age of 70. They found that for every 1,000 colonoscopies done in people over 75, only 2 lives were saved. But more than 20 people had serious complications. That's a 10-to-1 ratio. 10 harmed for every 1 helped. Let me tell you about Dana. 73. She ran a small bakery with her daughter. Energetic, bright, happy. Her new primary care doctor, fresh out of residency, suggested a colonoscopy. Dana had no symptoms, no blood in the stool, no family history, but she agreed. During the test, a small polyp was removed. That evening, she had severe abdominal pain. She fainted in the hallway. At the ER, they diagnosed a bowel perforation. She spent 9 days in the hospital, lost 10 pounds, and hasn't fully recovered since, all because of a test she might not have needed. Here's what most people don't know. The U.S. Preventive Services Task Force recommends stopping routine colonoscopy screening at age 75 unless there are red flags. Instead, there's a safer option. It's called the FIT test, fecal immunochemical test. It's done at home. No prep, no sedation, just a stool sample mailed to the lab, and it still catches most dangerous cases. So here's my advice. If you're over 75 and feeling well, with no symptoms, think carefully. Talk to your doctor Ask for options because, yes, prevention saves lives, but only when the prevention doesn't put your life at risk. Now, let me ask you, have you or someone you know ever had a colonoscopy after 70 and experienced complications? Was it helpful or did it cause more problems than it solved? Share your story below. Let's help others avoid silent dangers in the name of safety. Because doing more isn't always doing better, and sometimes your best protection is knowing when to say not now. Number 5, the full body scan trap. When looking too hard creates problems that weren't there. Let me ask you something. Have you ever felt fine, but still said yes to a full body scan just to make sure everything's okay? It's a tempting idea. You walk into a fancy clinic. They offer you a package, heart scan, lung scan, liver scan, all in one. And they promise peace of mind, but sometimes the price of peace of mind is panic. A full-body CT scan uses powerful X-rays to take detailed pictures of your entire body. And that radiation, it's no joke. Each scan delivers about 10 to 20 millisieverts of ionizing radiation. That's equal to 500 chest X-rays. 500. From one scan. Now think about this. According to a 2023 study published in JAMA Internal Medicine, up to 5% of all cancers in the United States may now be caused by unnecessary CT scans. That's 1 out of every 20 cancer cases, triggered not by disease, but by the scan meant to prevent it. It's painful irony. Let me introduce you to Marcus, 80 years old, taught martial arts at the community center, still agile, still sharp. One day, he was offered a senior elite screening package at a private clinic. He agreed. The full body scan found a tiny 3 mm lung nodule, harmless. But it looked suspicious. So began the chain reaction, PET scan. Then a needle biopsy. During the biopsy, his lung collapsed. He was hospitalized for 6 days. Took 2 months to recover. And in the end, the nodule was benign. No cancer, just a scar from looking too closely. Now let's be clear. If you have symptoms, chronic cough, unexplained weight loss, blood in your stool, then yes, targeted imaging can save your life. But if you feel well and someone pushes a scan just because, stop. Ask why. Because not everything we find needs to be fixed, and not everything we scan needs to be treated. Even the American College of Radiology now warns against full-body scans for people without symptoms. No proven benefit. Real potential for harm. Instead, talk to your doctor. Tell them what you're feeling, what you're not feeling, and work together on a plan that listens to your body, not just the screen. So now I ask you, have you or someone you know ever had a scan that led to more tests, more fear, and nothing dangerous in the end? Let us know in the comments. Your story could stop someone from falling into the same trap, because in medicine, more is not always better. And when it comes to your health, sometimes the bravest thing you can do is nothing at all. Number 6, the psychology of overtesting. When just in case becomes a lifetime of worry. Let me tell you something I've learned in 30 years of medicine. Fear makes people do things they don't need. And trust makes them say yes without asking why. It's human, especially as we age. You lose a friend to cancer. Someone you know had a heart attack in their sleep. Your memory feels a little foggy. You wake up tired for no reason. And somewhere deep inside, you wonder, am I next? That's when the cycle begins. You go in for one test. The doctor finds something small, maybe a shadow on a scan, a borderline lab number, so they order another test, then a referral, then a biopsy. Soon, you're not just checking your health, you're living inside a health system, appointments, paperwork, medications, side effects, fear. And the worst part? Most of this started with one harmless concern. Something that might have been solved with sleep, or water, or just someone looking you in the eye and saying, You're okay. Let's keep an eye on it. But in our system, that moment rarely comes. Let me be clear. Screening has its place. Modern medicine saves lives. But there's a difference between smart prevention and fear-driven scanning that looks for problems that don't exist. It's like turning up the volume on a quiet room until even the hum of the refrigerator sounds like an alarm. We begin to fear our bodies. We stop trusting how we feel. And that's when health becomes a burden, not a blessing. So how do we break the cycle? Start by asking this question before any test. If this comes back abnormal, what happens next? If the answer is more fear than clarity, more side effects than solutions, then maybe it's time to pause. You are not weak for saying no. You are not careless for waiting. You are wise for listening to both your doctor and your body. So now let me ask you, have you ever been caught in the spiral of test after test? Each one leads to more confusion, not more peace. Share your story below. There's healing in your honesty. Because part of brain health is not just protecting your memory, it's protecting your peace. Number 7. The 4 pillars of real prevention after 70. Simple, safe, and proven. So what should you do instead? After everything we've talked about, the risky scans, the unnecessary pills, the spiral of overtesting, what can you do to protect your health without living in fear? Let me share with you the 4 pillars of real prevention. No prescriptions required, no special machines, just simple, science-backed habits that protect your brain, your body, and your independence. Pillar 1, movement that builds balance, not just strength. You don't have to join a gym. You don't need to run miles, but you do need to move. Walking for 15 minutes a day can reduce your risk of stroke by over 30%, according to a study published in the Journal of the American Heart Association in 2022. Even standing up from a chair without using your hands. That's strength, that's balance, that's longevity. Simple exercises like leg raises, heel-to-toe walking, or using resistance bands can improve your coordination, build muscle, and prevent falls. Pillar 2, nutrition that fuels healing, not just fullness. Your plate matters more than your pills. After 60, the body processes protein differently. You need more of it to maintain muscle. Harvard researchers recommend at least 60 to 70 grams of protein daily for adults over 70, from lean meat, fish, beans, tofu, or eggs. And don't forget calcium and vitamin D, found in sardines, spinach, and fortified plant milks. A warm breakfast with eggs and greens, that's not just food, that's medicine. Pillar 3, mental stimulation and sleep. Your brain needs exercise too. Play games, do puzzles, read aloud, write a journal, but none of it matters without sleep. The National Institute on Aging reports that adults over 65 need at least 7 hours of sleep per night. Less than that increases the risk of memory decline, depression, and stroke. Create a sleep ritual. Turn off screens 1 hour before bed. Use a warm compress. Listen to soft music. Pillar 4, connection and trust. Loneliness is a health risk, and trust matters. Choose one doctor who listens, not 5 who rush. Find a small circle, family, neighbors, faith groups, and stay connected. Laughter lowers blood pressure. Kindness reduces inflammation. Hugs heal. So what does all this mean? It means your health is not hiding in a scan. It's not sitting in a bottle. It's not buried in a lab report. It's in your daily walk, your plate, your sleep, and your smile. Let me ask you, which of these 4 pillars do you already have in your life? And which one do you want to start building today? Leave your thoughts in the comments below, because this community is about sharing, not just listening. And remember, real prevention doesn't come from panic. It comes from quiet, powerful choices, made one morning at a time. Let me end with this. Your health is not a report. It's not a checklist. It's not a scan. Your health is how you wake up, how you move, how you remember moments that matter, the name of your child, the song you used to dance to, the story you tell your grandchild before bed. And if fear has ever made you say yes to something you didn't understand, that doesn't mean you were wrong. It means you were human and you cared. But from today on, I want you to remember this. Prevention isn't just about doing more. It's about doing what matters. Not louder, not faster, just wiser. So the next time someone offers a test, a scan, or a screening, take a breath, ask questions, and trust yourself again. Your body is not broken. It's talking to you, softly but clearly. And sometimes the kindest thing we can do is listen. Before we go, let me ask you, which moment in this video resonated with you most? What have you learned about your relationship with testing, with fear, or with trust? Drop it in the comments below. Your voice matters here, and your story could save someone else's peace of mind. And if you want to take one gentle, powerful step toward a sharper memory, I have something special for you. Watch this next. Do this exercise 1 minute a day and recover your memory like never before. It's simple. It's backed by neuroscience. And it's something you can do right now without a prescription. You've made it to the end of this video, and that means you care. You're not passive, you're powerful, and I'm proud of you. See you in the next video. And remember, protect your brain before it needs saving.